A sputum specimen can be collected in one of two ways: by expectoration or by suctioning. Start by checking the healthcare provider's orders to see which collection technique is to be used, how many specimens are needed, and when they're to be collected. After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify him using two identifiers.
Please tell me your name.
William Turner,
And your birthday.
3/16/47.
Okay, thank you. What we need to do today is get a sputum sample from you. I'll be back in just a little bit with some supplies.
Okay.
Then assess the patient's respiratory status and anxiety level.
Again. Sounds good.
Give the patient an opportunity to rinse his mouth with water. He shouldn't use mouthwash or toothpaste before specimen collection, because doing so may alter the results of the specimen culture. Apply clean gloves. To collect a specimen by expectoration, give the patient a sputum cup and instruct him not to touch the inside of the container. Ask him to take 3 or 4 deep, slow breaths, exhaling fully after each one. Then coach him to take a full inhalation, followed immediately by a forceful cough, expectorating the sputum directly into the specimen container.
3, cough. Now we're going to repeat that. We're going to do it again.
Repeat this process until you've collected 5 to 10 milliliters of sputum, not saliva. Before you collect a specimen by suctioning, position the patient in a high or semi-Fowler's position. Prepare and turn on the suction. Then connect the suction tube to the adapter on the sputum trap. Open the bottle of sterile water and pour the water into the sterile container. Apply a clean glove to your non-dominant hand. Using sterile technique, apply a sterile glove to your dominant hand. If the suction catheter has a plastic sleeve, you can use a clean glove instead of a sterile one. With your sterile hand, connect the sterile suction catheter to the rubber tubing on the sputum trap. Make sure the suction valve is off and lubricate the end of the suction catheter with sterile water. Warn the patient that the catheter will probably trigger her cough reflex.
It may trigger your cough reflexes, which is exactly what we want.
Gently insert the tip of the suction catheter into her nasopharynx or advance it through the patient's endotracheal tube or tracheostomy tube. Again, the suction valve must be off during this step. Quickly and gently advance the catheter into the trachea. As she coughs, begin to apply suction. Continue for 5 to 10 seconds, collecting 2 to 10 milliliters of sputum. Then release the suction valve, remove the catheter, and turn off the suction. Offer the patient some tissues.
Tissue for you.
Remove the suction catheter and the tubing from the sputum trap, and dispose of the catheter in the appropriate receptacle. Then connect the rubber tubing on the sputum trap to the plastic adapter. Whether you've collected the specimen by expectoration or by suctioning, note the characteristics of the sputum. Include its color, consistency, odor, volume, viscosity, and the presence or absence of blood. Tightly close the specimen container. If there's any sputum on the outside of the cup, clean it with a disinfectant wipe. To finish preparing the specimen in the patient's presence, attach the label to the side, not the lid, of the container. Place the specimen in a small plastic biohazard bag or other container specified by your agency, and attach the laboratory requisition form to the bag.
Here's your call light. Let me know if you need anything.
Thank you.
Immediately send the specimen to the laboratory for analysis, or refrigerate it for later transport. Now remove and dispose of your gloves and perform hand hygiene. As part of your follow-up care, Offer the patient oral hygiene and review the results of the sputum test when they come back from the lab.